What is it that you picked up with this movie? What's the lesson? Choices. What's the lesson? You decide now what it's going to be, right? What else?
Integrated lifestyle, right from the beginning.
From the beginning, an actually good lifestyle, a healthy lifestyle. Let me tell you what I think. The lesson is, don't be a Canadian. But we're all Canadians because these world lifestyle-related diseases are spreading everywhere. In the distribution of these at one time considered to be Western diseases, now becoming global diseases. Take a look at Pakistan. You know the statistics. 800,000 deaths due to preventable, non-communicable diseases. The statistics are very staggering. 34% of all the deaths in Pakistan are due to cardiovascular disease, which is actually totally preventable. Breast cancer, we have the highest rates of breast cancer of any Asian population. And then you look at diabetes, the highest rates in South Asia. And what is really interesting to me is that when it comes to obesity, when it comes to urban society, the facts are that probably 67% of adult women are not just overweight, but they're actually obese, which is much, much more. And yet, the statistics that I found suggest that 52% of those that are overweight actually think they're in normal weight. We don't recognize that many times we are carrying extra weight. We consider to be a little on the pleasantly plump side. To be in good health, it's a sign of prosperity, it's a sign of being wealthy. And we are trading away the advantages of a healthy for the wrong reasons. We need to become aware that excess weight contributes to premature death and disability. So, let's take a look at this here. World Health Organization says 2/3 of all disease worldwide is the result of lifestyle choices. And then a recent book suggested that when it comes to non-communicable diseases, changing the food you eat is the single most powerful lifestyle change you can make to restore your health. We're talking about reversing these chronic diseases. When we talk about chronic disease, we talk about diseases that we cannot solve medically. You can take all the medications you want for high blood pressure, for diabetes, for heart disease. It will not stop the disease. It just makes you feel better, puts you into a false sense of security in making the changes that are necessary. So what I want to do this morning, I want to talk to you about two portions of my presentations. First one is fork and knife, weapons of mass destruction. And the second portion will be fork and knife, instruments of health, hope, and healing. What choices are you going to make? So, and I want you to take a look at through the eyes of the American experience. This is now American data. Every third death in America is due to cardiovascular disease, every fourth death cancer. And then we have the idea that, well, everybody has to die someday. Why not die of a heart attack? That's a common thing to do, right? It wasn't. 1928, it was difficult to find a heart attack in America. That emerged more and more as we moved towards World War II. And today in America, we have 3,000 heart attacks a day. This is a new epidemic. Breast cancer, we have seen a dramatic increase in breast cancer. We have more and more medical care. We spend more and more money on medical care, and yet breast cancer rates increase. The answer is not more medical care. The answer is lifestyle medicine. What do you see there? You know, this is sort of in centimeters. It's about 17 inches for the last 70 years. 17 inches. But then, look what happened today. Now it's 24 inches. Something happened. Did the genes change all of a sudden? It takes about 300 years to change the genetic makeup in a society. This happened in the last 30, 40 years. This must be environmental. Then you look at diabetes. Again, you see a dramatic increase. In the last 20 years, we have seen an increase in America in diabetes by 300%, very close to what you have here in Pakistan. This is not a genetic disease. Well, you say, but it runs in my family. Yeah, it's not just the genes that run in the families, but also the recipes. Aren't they? And then you look at heart disease. Let's take a look at this video clip here.
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's a yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, Mr. Phillips, did you eat before you came to the hospital tonight? He said, yes. I said, what did you have? He said, I had a cheeseburger and a milkshake. And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. Well, 30, 40, 50 years of keeping your blood very fatty creates changes in the blood vessels that are very dangerous.
Over the years, arteries can become clogged with fatty material. Then a blood clot can form, blocking the blood flow completely. If the artery leads to the heart, the lack of oxygen can cause heart muscle to die. That's a heart attack. If the clogged artery leads to the brain, the patient has a stroke.
The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
See this again? This is what surgeons see every day as people come in with disease. But it's not just this narrowing of the arteries affecting the heart, but this affects all the major arteries in the body. The average person has about 60,000 miles of blood vessels. And most of the vessels are actually 1/10 the thickness of your hair. But it's the larger vessels that are becoming very much affected by this process called atherosclerosis, the building up of fat, cholesterol, and calcium inside of the arteries and narrowing the diameter. As you see here, we're born with clean arteries. By the time, if in America, by the time we're 20 years of age, we already have 20% narrowing. This is the same amount of narrowing that we found in China in people over 80 years of age. This is a reflection of the Western lifestyle. And as we move in age towards the 45, 50 years bracket, we begin to realize already 50 to 60% of the narrowing has taken place in people by the time they're 45 to 50 years of age. And Pakistan is no exception. I'm coming to you, an ambassador of goodwill from America. We have brought you these diseases, and we want you to recover from these diseases. But you have to go back to your native foods. You have to go back to what the master designer had in mind. You heard these quotations from the Quran this morning. It's right there. Maybe there's some wisdom we should listen to. And so when you begin to understand the concept of atherosclerosis, you also begin to understand that it's affecting all the major vessels in the blood, in the circulatory system. So when you have, for instance, you have myocardial infarctions affecting the heart vessel, or the angina pectoris affecting again the coronary arteries, cerebral infarctions, now you have the effect coming to the vessels of the brain, senility, hearing acuity loss, visual acuity loss. These are all related to a narrowing of the major arteries that no longer now allow the organs to be in the excellent optimal condition. And we call these then degenerative diseases because the underlying disease is atherosclerosis. Let's take a look. In America, people think that impotence is something that has to do with a lack of Viagra. I have some news for you. It's related to what happens in the kitchen. What happens in the kitchen is what happens in the bedroom. We talk about a narrowing of the penile arteries that are much, much smaller than the coronary arteries. And so oftentimes, a decline in libido is oftentimes the first sign that something is happening, probably affecting the arteries and the hearing and everything else. It becomes a predictor of what is going on in the system. And so let me just give you some ideas. What is related to these kind of new diseases related to atherosclerosis? It has to do with risk factors. Just to give you some idea, if you have a high cholesterol, you have a high blood pressure, you're a smoker, you have diabetes, you didn't pass the treadmill test, you're 35 years of age, male, the chance of a heart attack in 6 years is 140 times more likely to happen with this profile in comparison to having ideal cholesterol that should always be below 4. Having low blood pressure, you have no smoking, no diabetes, and so on. These are factors that we can change. We can bring cholesterol levels down by 20% in just 4 weeks by making some dietary changes. All you have to do is go back to a more Pakistani diet. More potatoes, more yams, sweet potatoes, more beans, these kind of things, more barley. These are the kind of things. And then when you begin to look at these risk factors, please note, the higher the factor is on this arch, the more powerful they are in driving this disease. So the big three, cholesterol, high blood pressure, and smoking, these are the big drivers of this disease called atherosclerosis with its many different clinical expressions. And please note, you see the yellow star? What do you think that means? They're all largely under control of our lips. Our lips get us into a lot of trouble. Cholesterol is 80% related to what we eat. High blood pressure is 85% related to what we eat. Smoking relates 100% of what we put between our lips, right? Obesity, would you agree that it has something to do with what we put between our lips? There you go. So let me just give you a little idea what happened in America in the 1970s when we changed our diet dramatically. You see what happened? In 1972, change began. We shifted from slow food to fast food. We shifted from cooking out. We no longer would eat potatoes, we would eat Pringles. We would no longer eat beans, we would eat burgers. We would no longer drink water, we would drink soda pop, right? We would no longer eat grains, we would eat Oreos, right? You have them right here. It's in the hotel room, I saw it. I thought I was going to warn you, don't let these folks bring you these foods to Pakistan. It's dangerous. It's already here. I'm too late. And this becomes then very, very important because when you change from these foods as they come to us in nature and you move towards processed foods, when you push the animal products more and more because of prestige food, then what happens, you change the diet composition of people. As the country becomes more and more affluent, you know what happens here? The unrefined starchy foods become less and less and less. The sugar becomes more and more and more and more. And the fats from animals and vegetable foods become more and more. And also you see the protein consumption dramatically increases because now the protein, in addition to the protein you get from foods, from plants, now comes from animal products. And whenever you have this kind of a diet composition, this is the modern Pakistani American diet composition. When you have this kind of a diet composition, you always will have these non-communicable diseases. You can go around the world. You go to countries where they don't have diseases, and then the American, Western, the modern foods come in, and within 5 to 10 years, you see the emergence of heart disease and hypertension, obesity, and so on. These are not just associations. These are causal relationships. Let's just unpack this just a little bit here. You see the dramatic increase in America in terms of the sugar consumption, and it's not very different here, is it? No nutritional value, just sweet taste and sour effect. And then you look at the consumption of oils. We used to eat corn, but now we tend to take corn oil. Did you realize it takes about 14 ears of corn to extract 1 tablespoon of corn oil? In the old days, when you didn't have this extracted oil, you would have to get your oil by eating the corn as it was. And you could never overeat on oil. Because how many ears of corn can you eat in one session? Now, with the advances now and the advent of these extracted oils, look what can happen. You now can use good, healthy, royal, nutritious food like potatoes. You can turn it into a disaster. You see, Pringles, that's about 63% fat. Pringles have very little to do with potatoes. People say to me, well, I eat potatoes, I eat Pringles. Well, not really. And then you have this nice little treat there, and you know, you have a nice little romantic moment, and you have this big milkshake there. Yeah, that's 2,000 calories. I mean, a woman probably doesn't need more than 1,500, 1,600 calories a day. You just have one little treat. And when you come to me and say, I want to lose some weight, and I ask you, what do you eat? Well, I eat like a bird. I hardly eat anything. I eat like a bird. I said, what kind of a bird are you? And they don't even remember that they had this big milkshake. It's so easy. The environment is totally seductive. It makes it so easy to overeat. We don't really often be aware of it because we're talking about caloric density. It comes in small packages because it's devoid of fiber. And so this is then the new level of how we live and eat. And that is that probably 30, 40, 50% of our calories are now coming from empty sources. Empty means it has very little nutritional value, if any at all. Brilliant taste, high in calories, promoting chronic diseases. So many societies today, including America, we are overfed and undernourished. I mean, we always thought malnourishment has to do with not getting enough to eat. The modern epidemic of malnourishment has to do with having too much to eat, but the wrong kind of food. And so this was the first shift as we shifted from foods to industrialized products, from food processed products. The second shift 30 years ago that began was a shift towards more and more animal products. Here you see what happened in America. We almost doubled the consumption of animal foods, particularly poultry and cheese. Just to give you some idea, when you look at meat, you don't really think of protein as many people do, but you begin to think about fat. When you have that American hot dog, that's 85% fat. And I don't think you want to know what the other 15% are made from. Because everything you cannot sal goes into those hot dogs. When you look at cheese, to reckon cheese is 70% fat. That's a very fatty product. It's very, well, it's very addictive, isn't it? It's very addictive. It's like a glue. It holds the pizza together. But it takes us apart. Because most of the fat in cheese is saturated fat, and as you know as nutritionists, it's the saturated fat that drives the cholesterol in the liver, that causes the cholesterol in the bloodstream to go up, which drives the heart disease and atherosclerotic disease processes. It's the number one factor. Today in America, the number one source of food that drives the high saturated fat content is cheese. And people can't let it go. It's just there. And they invent new recipes every day because the industry doesn't know what excess milk, cheese that they have. So we should be really, really careful about some of these modern products. We should use them deliberately in small portions if possible because there's an addictive quality to cheese. So this is the American diet. This is probably very close to the Pakistani modern diet too, where you have about 51% of the calories that you eat comes from processed foods, 26 plus 9, about 35% comes from animal products. And this is the important part that I want you to remember. Only 14% in America, and maybe close to that here too, only 14% of the calories consumed today come from fruits, vegetables, whole grains, legumes like beans, and maybe a few nuts. This was the original diet that today has become a total minority portion of the westernized diets. And when you look at fiber which is so essential, particularly in the management of diabetes, fiber which is so essential in managing overweight. Fiber today has become reduced to about 10 to 15 grams, and most scientists perhaps suggest today it should perhaps 3 times more. When you have these low fiber diets, you don't go into a bathroom and then you go out very quickly. You sit there and you try to struggle in being productive, especially when you have a 65-year-old person. And then you're lucky you get 1 or 2 products a week. It's a lack of fiber, lack of enough water in the diet. Sometimes the causes are so simple that we overlook them. I think you have to have some of the medication. You follow this diet where you have most of the calories coming up from the 14% there. They come from fruits, vegetables, whole grains, legumes. These are high fiber foods. You go to the bathroom, you go in, you're out, you're done. You no longer have time to read the Reader's Digest from the back cover. No, you're done. So please note that probably 80% of our chronic disease and premature death could be prevented by making significant changes in diet and lifestyle. What do you put on your fork? What do you do with your feet? What do you do with your heart being a nicer person? Being more focused altruistically rather than selfishly, hedonistically. So the last part I want to sort of deal with is now, if you use fork and knife differently, would it make a difference? Yes, it would. You can reduce your food bill by 40% by eating more of what? Fruit, vegetables, whole grains, and legumes, and perhaps a few. 1, 2, 3, 4. Fruits, vegetables, whole grains, and legumes, and perhaps some nuts. Very good. So, this is what we do in America. In America, Do anything you want to do because the doctors will take care of you. Right? And if the doctor doesn't, well, I'm going to see a real doctor. I'm going to see a specialist. I go to the best hospital. Folks, it doesn't make any difference. Please let me give you some ideas. We can do wonderful, outstanding things with modern medical care when it comes to when it comes to acute illnesses. When you have infectious disease, don't come to ask me, how much broccoli should I eat? No. You go see the best doctor. They can diagnose the disease, and they can put you on the right track. But when it comes to chronic diseases, we're very limited, but the people don't understand this. They have this idea because they can take care of my infectious disease with some antibiotics in 10 days. Therefore, if I have a heart disease, they can fix it too with a bypass. Wrong. Oh, you have diabetes. Oh, they can take care of infectious disease. They'll give me the right medication, the right insulin. I'll be okay. No. Oh, I'm overweight. Oh, there must be a pill for overweight. No. We are the chairman of the board of health. We have to begin to take more responsibility. We have to become, as I talked about it here, to become more self-regulating, right? We have to become more responsibility-oriented. And that's what lifestyle medicine is all about, to motivate and to encourage and to educate and to inspire people to do things that they don't really want to do. It's true, isn't it? You don't want to give up that cheeseburger. But once you understand and you remember this picture there, maybe you have some second thoughts the next time. And as we begin to make the change in the culture, as we help restaurants to become more adaptable towards healthier meals, and the people come and they want healthier meals, it becomes a counterforce towards the epidemic that we have in our culture, because the culture promotes the disease. Advertises everywhere. Have you seen any advertisements recently for eating more carrots? Or for more beans? Eating more potatoes? No, there's no money there. You buy the processed products. So when it comes to heart disease, look at bypass surgery. In America, we have about 400,000 of these at $150,000 US a piece. And let me mention something here. The closure rates within less than 2 years is 50%. Every second bypass is no longer functioning within 2 years because nobody told the person, you got to change. Maybe we saved your heart having the bypass. Maybe we saved your heart giving you the stent. But unless you got to move towards a diet as we used to have it. You have to get into an exercise program. Unless you do, these bypasses are no longer functional 50% in less than 2 years. Are you with me? But there's nobody that tells the people that. The surgeon doesn't say anything. That's not his job. And the family practice person, and we don't have time to do it. We have 10, 15 minutes to see the patient. We need to do it in groups. When we do the CHIP program, we run in groups of 20 people, 100 people. I've had 1,000 people in these classes. And it's not just 1 hour, it's 35 hours to really give people a comprehensive understanding how the body works so that you empower people, that they can do it on their own. People love it. They feel empowered. And they become more self-regulating. And they feel, I'm victorious over a habit I thought I could break. Yes, I can get into a breakfast habit. Yes, I'm going to bed a bit earlier so I can get earlier up to have my breakfast in the morning. These are basic things. But people have the idea, for every ill, there's a pill. They can work very well when it comes to infectious diseases. They also work well when it comes to chronic diseases, but they do not cure. You can take all the cholesterol-lowering drugs to lower your cholesterol. It doesn't help your heart to prevent that first heart attack. So the pharmaceutical industry has a very powerful grip on the medical profession in many of the societies. And that's why I wanted you to see this picture there. Have greater respect for using medication. Sometimes we need them, of course, and we're grateful we have them. But especially when it comes to these chronic diseases, read the labels of side effects. I mean, they tell you right there on television when they have the ads. May cause this, may cause this, may cause death. Hello? Shouldn't I check it out a little bit more carefully? So in America, the number 3 cause of death, right after cardiovascular disease and cancer, the number 1 cause of death is the use of prescription drugs. Either people don't take the medications correctly, or there's an interaction between different drugs that nobody thought of, or we're just taking them too many. This is American medicine. What do you see there? Do we have a microphone here? What do we see? Let me ask somebody. Let us just pretend that we're all blind. Could you please tell us what you see in this picture so that we as blind people get a picture of what you see, the only one that has eyes to see?
The root cause is not addressed. It's
No,
just,
describe it carefully. I see. What do you see?
I see the pipes leaking.
There are
People
pipes
are-
on the picture, up in the ceiling. What happens to the pipes?
They're just leaking and...
Oh, they're leaking pipes. Okay, be very descriptive. Help us understand. So you see pipes that are leaking. What are they leaking?
It look like they're just sprinkling water down there. And people are busy just mopping the floors, and there's a person there in the gurney, I guess, and he's having an umbrella there.
Yeah, very good. Did you all hear this? You see people, this is the hospital scene. This is a hospital. They're all there, the beds are there, and we have leaking pipes, and we pass out umbrellas to the patients. Folks, and then we're mopping up because mopping up pays very well, so we mop up, and nobody goes upstream to turn the thing off.
Right.
And this is what happens then. In 1960, America spent 5% of their income on medical care. Today, it's 19% of our income is spent on medical care. That's why small countries like Lithuania, where we spent some time, they say we cannot afford high-tech care after the fact. We need to do preventive medicine. We need to do reversing these diseases through lifestyle medicine. And that's why lifestyle medicine is now sprouting up all over the world. So let me give you some ideas. This is World War II. The Nazi armies overrun Norway. They take all the livestock away from the people to feed their soldiers. And the people in Norway have to live on very simple foods that they have to grow in their garden. And the people in Norway become healthy. Now that wasn't the intent, was it? But you see what happens here? Within 1 to 2 years of the occupation, heart disease rates and cancer rates drop dramatically in Norway within 1 to 2 years. I mean, this is war. This is anxiety. This is stress. We always have been taught that stress causes heart disease. Folks, this is stress, and heart disease goes down big time. Are you with me? And people say, well, it could have been the fact that they would have to eat very simple food. Well, let's see what happens when the war ends and people can go back to their pre-war diets. What happens to the heart disease? Climbs up again. Diabetes comes back again. Cancer rates go up again. I mean, there's a relationship between what people eat, their disease. We can take monkeys. We have done this. We can take monkeys and we give them a typical hospital diet. I'm sorry to tell you this. You put these monkeys on, and 19 months later, these monkeys all have died of myocardial infarctions or heart attacks. We tell our chip people, don't stay in the hospital more than 19 months. It's a dangerous place because we don't offer healthy foods there. We just want to make the people happy, right? They're in pain, we give them whatever. Folks, it's not the way to go. So we know we can create these diseases in monkeys very easily. We can also reverse these diseases in monkeys. All you have to do is give them a very simple diet, like you used to have here in Pakistan 30, 40 years ago. And these monkeys, even though you have created this disease, the disease begins to reverse itself in less than 2 years. Atherosclerosis, then in summary, is something that affects most of our large vessels, creates most of our Western kind of disease that have not gone global. They can be created and they can be reversed based on what you're putting between your fork and your knife and your lips. Here's some data. This is Dr. Dean Ornish, published in 1990 in the Lancet Medical Journal. He took 48 patients with serious heart disease. Half of them he put on a very simple diet. This was actually a plant-based diet. It was a very simple diet, very low in sugar, very low in salt, basically a very simple diet. And the cholesterol numbers dropped by 24% within weeks. They stayed there for a year. And at the end of 1 year, 82% of these plaques had reversed themselves. Should I say this again? Heart disease, simple diet, plus exercise and weight management, as well as some stress management. They showed within 1 year, 82% of these plaques had begun to reverse themselves. In contrast, the usual diet that was given to the patients in the hospital, this is called the usual care diet, the American Heart Association diet. In this case, the plaques actually progressed. Atherosclerosis became worse in 53% of the cases. Then you have Dr. Esselstyn from the famous Cleveland Clinic. He took the walking dead. They were given 6 months, 12 months to live. They already had their bypasses and stents. They came to this doctor who was an educator, and he said, if you follow my program and you stick with it, I want to demonstrate that you can live longer than 6 to 12 months. But find the book. It's called Prevent and Reverse Heart Disease. And it talks about 20 cases came to the program, followed a very simple diet. That's all he did. Within 20 years, all of the people are still alive except for one. They were supposed to be gone after 6, 12 months. This is 20 years later. They're almost all of them, no heart disease, no heart attacks, no bypass. There you see some of the results. These are coronary arteries. This is what you see on an angiogram. This person has serious heart disease. There's very little blood flowing through this coronary artery here because they have atherosclerosis here. 2.5 years later, the same person, no medication, no surgery, totally restored. The power of restoring
How did you
health.
lose so much weight? What kind of diet are you on?
Well, the short answer is I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit, no dairy, and it changed my whole metabolism, and I lost 24 pounds, and I got back to basically what I weighed in high school. But I did it for a different reason. I mean, I wanted to lose a little weight, but I never dreamed this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that it clogged up, which means that the cholesterol was still causing buildup in my vein that was part of my bypass. And thank God I could take the stents. I don't want it to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey, if you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up. The calcium deposit around their heart breaks up. This movement has been led by a doctor named Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish, whom you know, out in California, the doctors Campbell, father and son, who wrote the China study, and a handful of others. But we now have 25 years of evidence. And so I thought, well, since I need to lose a little weight for Chelsea's wedding, I'll become part of this experiment. I'll see if I can be one of those that can have a self-clearing mechanism. We'll see.
In closing, let me point out also that what you do for heart disease will also help your diabetes, will also help your high blood pressure. It affects the whole body and all the systems that we have. Take a look here at diabetes. This goes back to 1955. It has been with us every year there are research studies that tell us over and over again, if you really want to change diabetes, you have to move towards a more natural, whole food diet. You have to really cut back on the fats and oil and grease. You have to cut back on your sugar, of course. You have to increase fiber, which is really a magical component. Please note, 1955, 80 patients on insulin, diabetics. Within 6 weeks, 50 out of 80 patients are no longer diabetics. As long as they follow through on the program, they'll never have to go back to being considered to be a diabetic. As a matter of fact, 85% of these 80 patients on insulin initially were off medication over the next 18 weeks. Here's the guru of diabetes treatment, Dr. James Anderson, personal friend of mine. He's written over 500 books and scientific articles on diabetes. He said 50 to 75% of these diabetics on insulin and 80% of these on pills could normalize their blood sugars and be off medication within weeks, 3-4 weeks. Let me give you some results. This is what we have done in our CHIP program, CHIP, the Complete Health Improvement Program. We have people there for 30 days. We had 525 diabetics. Within 30 days, we only had 301 diabetics. What do you think happened to those 224 that were no longer there? What do you think happened? They all died? No. They were no longer diabetics. They were in the normal blood sugar range in less than 30 days. We do the same thing with high blood pressure. We had 210 hypertensives on this is high blood pressure problems within 30 days from 210 down to 69. The power of the body. The body wants to heal itself, but you cannot take a Ferrari and pour diesel fuel into it. You've got to put the right numbers into that fuel that you give that Ferrari. And that's how it is with the human body too. This is my closing slide. You heard what President Clinton said. He said he has moved towards a diet of fruits, vegetables, whole grains, legumes, maybe a few nuts, and lots of water. This is the goal, to go back to its more native lifestyle, a native diet. Put some exercise into it, become a nicer person in the process too, and begin to shift from this typical diet that has become the standard diet around the world more and more and more. But we need to begin to recognize, unless we begin to move in this direction here, we cannot deal with the emerging epidemic and catastrophe of, what's the name? Communicable disease. Chronic diseases will more and more unless we make some of the changes that we need to make. So remember, food can either be the slowest form of poisoning you, or food can be the safest and most powerful form. Website, and you can find, you can download. All you have to do is go to www.chiphealth.com/happy, and you find your optimal diet delineated there. Thank you very much.